Hey everyone, thank you so much for coming back for another episode of Excuse Me, Doctor. My name is Dr. Melissa Clark. Please call me Dr. Mel, and welcome to this episode. We are here each and every week specifically to bring you the information that you need to make sound, wise health decisions, not just for yourself, but also for your family and even your community. So, if you're joining us for the very first time, please feel free to hit that like button if you're checking us out on Facebook, and that subscribe button if you're checking us out on YouTube. And most importantly, we want to hear from you. So, there's a chat. Feel free to enter your comments, your questions in the chat as we go along, because we are here for you. And those of us who've been here before, I call you my Be Health Empowered family. Welcome back. And you know that I always have to do this with my two incredible co-hosts, Lila Mays and Wayne Bruce. Come on in. How y'all doing? What is going on?
Child, it's Monday, and I mean, it's every bit of Monday.
It's Monday.
It's every bit of Monday.
It is Mercury retrograde Monday, where everything can and will go differently than how you planned it.
Oh, technically, we on a different page today.
But we making it happen. I am glad that you all are here with me.
I don't know what's happening on the show today, Dr. Mel.
We are going to create an amazing week regardless with everything that we are going to cover today. And, we're glad to Be Health Empowered Family is here to check us out, make a show with us. And today is that once a month episode that we do with Howard University Research Centers and Minority Institutions Community Engagement Core. I can't say that without taking a breath. So, of course, Karen Parker is right there waiting to join us. Hey, Karen.
There she is.
Hi, everybody. Here we are once again. And it's definitely Mondaying over here. I can attest to that.
Right. Well, remind everybody about about Howard University and what the Community Engagement Core does at RCMI.
Absolutely. What can I say? First of all, I'm just happy to be here for the last time in 2024 with everybody. We've been doing this for just about a year now. And part of what we do is engage with the community. We listen to what our neighbors want and need from research. And we make sure that the research that we do at the Howard RCMI program is relevant to the needs of our neighbors. So it's a lot of listening and a lot of engaging like what we're doing tonight. Happy to be here. Happy holidays to everybody.
Yes, absolutely. Happy holidays. And we want it to be a happy holiday for everyone where they still stay well and rested and all that good stuff. Because, we did a mental health episode last week where we talked about your wellness toolkit from a mental health perspective during the holidays. And today we're going to talk about the physical health aspect of staying well during the holidays.
I love it.
Right?
I love it.
It's important. Like I said, I'm glad you guys are taking over this thing, because actually Wayne Bruce doesn't have anything knowledge of today other than I know it was Winter Wellness Day, and we're going to get everything straight with a fantastic guest. So I prepared for the winter.
I see you.
Right.
I just don't have the red and black lumberjack like Biggie would say. But I got my Scully on. I got my scarf, and I'm trying to prepare for everything that's going on with us, during the winter.
Well, thank you for reminding us to bundle up, because it is cold and flu season out there.
It is.
And I know a bunch of people that have gotten pneumonia. And it's not even really winter, because winter doesn't officially start until December 21st. But, we're already seeing, folks having to, stay home from work, even go to the hospital. So,
Yeah. I mean, you might want to also mention that to the weatherman in Florida. I heard they just got their first freeze this weekend.
right.
Oh,
That is
wow.
true.
It was probably more like 60 degrees though.
Right, right. Well, we know people are hitting those indoor holiday parties, traveling to get together with family, maybe to Florida, maybe somewhere else, crowding in
Mhm.
malls for holiday shopping. And then, we push ourselves to be active when the rest of the earth is really moving towards hibernating, right? We're doing the opposite. So we get out of sync, and we might not even know that we're setting ourselves up to potentially get sick.
Yeah. This is where I was supposed to say something really smart, but I'm technically dealing with Monday. So you guys have to say something really smart. Yeah,
It's
we are
not a problem. I think our smart might be our default, right, Dr. Mel?
right.
Well, I think it brings us to what we're talking about tonight,
Yes,
which is
yes.
being a winter wellness warrior, staying well despite all of those things that I mentioned. So I'm going to turn it over to Karen to kick us off and introduce our guest, Dr. Stephanie Brown.
Absolutely. I'm very pleased to welcome my bison sister, Dr. Stephanie Brown, to the show this evening. She is a board certified family physician with over 25 years of active clinical practice, and the last 12 of those were in urgent care. She has been a preventive care researcher, and she's also an executive life coach who believes that healing is not just physical, but it's also mental, spiritual, emotional, and social. Welcome, Dr. Stephanie Brown.
Hello, hello. Thank you so much. It's good to be here. My Monday has been Mondaying as well. So it's nice to be here.
Join the party.
We are very pleased to have you.
So I'd like to start things off, if I may. I want to just jump right in and talk about, because let's start with your family medicine hat that you wear. How does your practice change at this time of year, December through February? Do you see different types of things coming into your practice? What do you see a lot of? Let's start there, please.
Absolutely, absolutely. So, as you mentioned, the past 10 years I've been in urgent care. So, I work in a lot of different urgent cares in different locations. So, kind of travel around. But one of the things that is for certain, as the weather starts to get cooler in the fall and the winter, the things that I see change. There's no more of the poison ivy and the rashes. It's really a lot of respiratory illnesses, a lot of coughs, a lot of sneezing, a lot of colds. Um, we still see some of the regular, back injuries and things like that, injuries, but we see a lot of the respiratory stuff. So I would say that that is the majority of what I see in the wintertime.
Makes perfect sense in light of all those things, the spreading of contagious illnesses from all those things I talked about in the intro. And there are lots of different reasons for that. Let's start off with something that people have heard a lot about but might not know a lot about, which is walking pneumonia, quote unquote, which is really a medical term. It's how it describes a particular pattern of symptoms. So what is it? What causes it? Tell us a little bit about walking pneumonia, what we need to know.
Yeah, it's actually a very good way to classify it because it is a milder form of pneumonia that you can actually walk around with and continue to go about your daily activities, but you still have these symptoms. So it's really a milder form of pneumonia. So the other type of pneumonia we think about is usually hospital-acquired pneumonia, the type of pneumonia where you're in the hospital. So walking pneumonia, sometimes the symptoms are so mild that you think that it's just a cold, but you realize you're not getting any better. But it's an infection of the lung. So that means at the level of your lung, you've got these air spaces that are meant to, help you breathe and inhale air. And sometimes you get fluid or mucus in those air spaces instead of the air that should be. And that's when you have pneumonia. It can be caused by a bacteria, a virus, and sometimes even something like mold or a fungus can cause you to have bacteria. So if you work in an environment where you're exposed to those types of things, it can get into your lungs and cause pneumonia. But when we
Yeah.
think about, when we think about walking pneumonia, it's typically you've got a mild low-grade fever, less than 101. You are, coughing, sometimes bringing up stuff. You may have had some sneezing. You may have fatigue. You're just tired. And you're just like, I'm so tired. I can get up and go to work, but then after that, I'm sleeping for the rest of the day. I can't do any of my regular activities. And you're just not really getting better like you would with a regular cold. You're still sick and you're still coughing. That's typically some of the symptoms that you experience with walking pneumonia. And for whatever reason, there's something that kind of happens every 3 years and every 7 years where we get these spikes in pneumonia, and we happen to be in one of those years because there's a huge spike.
Yeah. I can't tell you how many people I know who have called me and told me they've actually even been hospitalized. I know 2 people off the top of my head who've been hospitalized with pneumonia that they acquired not in the hospital, but just out moving around. So is there a treatment for it?
Yes. So, bacterial, if it's caused by bacteria, we treat it with antibiotics. And usually for walking pneumonia, it's also called atypical pneumonia. So there's certain antibiotics you probably have heard of, like a Z-Pak, that's often used for walking pneumonia.
Right.
If it's a virus, we treat it with a lot of supportive care. So, over the counter medications and your own immune system, making sure your own immune system is strong enough to fight it off because viruses don't respond to antibiotics and we don't have an antiviral treatment for pneumonia. But there is treatment. So, if you think that you might have walking pneumonia, you may want to seek some care so you can get some treatment.
Makes sense. Thanks.
That's helpful. Thank you. I'd like to switch it slightly to what we've been hearing about over the past few years, of course, COVID-19, RSV, and influenza, and that's referred to as the triple-demic. And I'm curious to know, is there a variance and occurrence that is there a difference in how often it shows up in Black and Brown communities, first off?
There absolutely is a difference. And some of us are probably not surprised that actually all three of those have higher prevalences in Black and Brown communities. RSV a lot of times affects children, and Black and Brown children, it affects them more and they can get sicker from it as well. And when it comes to COVID, and we may remember from when the pandemic first occurred, uh, Black and Brown people get it at a higher rate, and we get sicker from it, are more likely to be hospitalized, and unfortunately, more likely to die from it. And then when you look at the third one from the triple demic, so we talked about RSV, we talked about COVID, and then flu.
Yes.
Flu has been around forever, but people still die from the flu. And if you're Black or Brown, your chances of dying from the flu or getting a very severe case are higher than if you're not.
Yeah. So thank you for that rundown of each of those. I just want to go to COVID for a minute. Is COVID still a thing? I mean, do we need to be concerned about it? Should we be getting vaccinated for it? What are your recommendations on that?
Yeah. COVID is still a thing. It's one of those things that, when we're in active practice, we kind of track it on a weekly basis. And so the latest statistics that I saw said that COVID is increasing in 28 states. In Maryland and DC, it's likely to increase. So they said increasing, likely to increase, staying the same, or decreasing. I don't think anybody was decreasing. So in Maryland and DC, it's likely to increase, but in Virginia, it is definitely increasing. And in the DMV, Virginia is so close to Maryland and DC; those cases are gonna come and knock on our door pretty soon too. So it's definitely still a thing. We should still get tested. Luckily, because of vaccines, we've seen a decrease in morbidity and mortality, which is just people getting really sick and people dying from it. So I definitely recommend that you stay up to date with your vaccinations. It may not keep you from getting it, but you will definitely be less sick and less likely to be hospitalized or die from it if you do get it. And if you may not get it, and you may not give it to somebody who is elderly, or who's on chemotherapy, or who doesn't have a very strong immune system. So it's about protecting ourselves, but also protecting those around us that we love.
And is there still a reason to test for COVID? You mentioned that. Why test for COVID if I have a mild case, for example?
Yeah. Well, the main reason to test for COVID if you have a mild case is, we talked about all of these respiratory illnesses. It's really hard to tell them apart without testing. And some of them have treatment and some of them don't. If you have certain illnesses, if you are diabetic, if you are overweight, if you have uncontrolled hypertension, which a lot of people have those things, then there is a recommendation that you take an antiviral called Paxlovid. And definitely if you have known heart disease or, pulmonary issues like COPD or asthma, then you may be in that category to want to take the Paxlovid to prevent you from getting really sick. So you want to be treated. And then there's also, you don't want to spread it to, your grandmother or your spouse or whoever else who may not have as strong an immune system as you. So if you're more likely to wear your mask and to isolate so that you're not spreading it.
No, thank you so much for that. I would just throw in too, long COVID. There's a lot of data that suggests that if you get vaccinated or if you get COVID and you get treated with Paxlovid, you have a lower incidence of getting long COVID. So all things considered, is very advisable to do both. Karen, you were about to jump in.
I was. I was just thinking about the transmission you were talking about, giving it to your loved ones. And this time of year, we are connecting with our loved ones. So I think that that's a great reminder to kind of do everything that we can so that we're only spreading love this season.
I love that.
I wanted to, thank you. I wanted to sort of jump from that piece that we were just discussing. And Dr. Stephanie, if I can call you that, you mentioned that we have to look at the symptoms and sometimes they look the same. Are there any differences in the symptoms in that tripledemic between COVID and the flu and RSV?
Yeah, that's a great question. RSV has the least symptoms of all. RSV, typically you have runny nose, you may have a cough, and you may have some sneezing. You don't typically have a fever. You don't typically have the body aches or the chills that you might have with COVID or the flu. So that would be the one that is maybe the mildest symptoms, unless you start to develop difficulty breathing. The differences between COVID and flu can be hard to parse out. I think that with the flu, a lot of people tend to say, I feel like I just got ran over by an 18-wheeler. They just feel completely miserable. The body aches, the chills, a lot of times a high fever, headaches. Sometimes you're sweating. You may also have some stomach issues. COVID, I think COVID is like a chameleon, right? It can show up in so many different ways, and it depends on what variant of COVID we're getting. But you can have like almost any of those symptoms, but you usually don't feel quite as just like something just came and knocked you out of the blue as you do with the flu?
I'd have to say that you're right. It is a chameleon. Unfortunately, there was a variant this summer that carried my initials. I had nothing to do with it, but it did feel like a Mack truck. It was horrific. Also, I wanted to ask about that. I think I saw that there was a test that you could take that is supposed to be able to, a home test that you could take that could tell you whether you have the one or the other. Have you heard of that? And what are your thoughts on that?
Whether you have COVID or the flu?
Yes.
Yes. I have heard of that test. I think it's great when you can empower yourself with as much knowledge about your health as possible. You might be able to take the test and let your doctor know, because, primary care offices are just booked a lot. You may be able to let them know, well, I tested positive for this, or I tested positive for that. And if they feel like it's a valid test, they may treat you without you having to go in and be seen if if your symptoms are mild. So I think and once you take the test at home and you find out the results, you may be more motivated to go in and seek treatment. So I have not heard any bad things about the test. I think that by the time they get to market and they go through the FDA, they tend to be fairly accurate. Not as accurate as what we use in the office, but fairly accurate.
So that's helpful. And then I have one last question on this triple-demic piece. You mentioned just now about how the RSV symptoms are really mild. And is this the same thing that puts very small children in the hospital? And I'm wondering if the symptoms are so mild, like you said, the runny nose and maybe the sneezing, but no fever, how do you know when a little one needs, more specialized care, or when you should bring them in? And I'm thinking about, little kids who just want to finish out the year in school and go to their little Christmas parties. Like, how do we manage that?
That is a great question.
Thanks.
I think that a lot of times parents kind of have an idea when something is not right with their child. They're not interested in playing. They're not interested in eating. And they just got this cough. They've got this runny nose, and they just don't seem to be themselves. That's a good enough reason to bring them in and get them tested. RSV shows up as mild, moderate, and severe. And it's really hard to predict which children are going to get the severe symptoms, except for age. The younger the children are, the more likely they are to, have severe symptoms. And it really comes down to their breathing. If you start to notice any difficulty with them breathing, they're sort of breathing faster, or they seem to be using a lot more effort to breathe, those are the kids that we're probably going to want to be in the ER for monitoring or for oxygen. So definitely, if you notice any signs with breathing, you want to bring them in. But if they're just not acting themselves, bring them in.
Okay. I think that I thank you for highlighting that the youngest ones, the infants, are at the greatest risk. And I think we also too have to think about the other extreme of age, that for RSV, flu, and for COVID, that people with pre-existing conditions and people who are elderly are also at a higher risk for having more severe symptoms. Like you said, RSV can show up in a severe form, and it might be also too at those extremes of age. That was great. Thank you for also highlighting for the little ones, when you see difficulty breathing, that's a time to come in. What are some of the other things that, other age groups should think about? If you're trying to manage your symptoms at home, what are some signs that, hey, I really should go in and get this checked out because I'm not doing well on my own?
Yeah. That's a great point, because I think we probably see people who wait too long to come in, and then they're like really, really sick. If you think about the common cold or upper respiratory infection, if you think that you have a common cold, you've been taking Dayquil, NyQuil, and you're still sick and you're going on day 7, that's probably time to come in and get evaluated. If you've been through, 2 or 3 bottles of Dayquil or NyQuil and you're still taking medicine, that's probably another good time to come in. And if you have a fever that you're around the clock taking medicine to get the fever down for more than like a day or two, then you want to come in and see, okay, is there a bacterial infection going on that's why this fever is persistent. Always breathing. If you start to have difficulty breathing, you're going up a flight of stairs that you can normally go up and just jog up, and you get to the top and you're really winded. That's one of those signs. I need to get this checked out. I think there are a lot of them, but I think those are some of the ones that really stand out that people may experience on a daily basis.
Yeah, no, that makes sense. And you mentioned the Dayquils and the NyQuils. I guess I would throw in the Motrins and the Tylenol PMs and all that. Are all over-the-counter remedies okay for everyone to take? Are there certain groups of people who should be avoiding certain classes of over-the-counter medicines?
Absolutely. And with the over-the-counter medicines, it's overwhelming because there's so many. There's so many different variations of medications, and they have so many different things on them that I think some people just don't want to take anything. And that's great if you just want to contact your doctor and get some advice before you take something. But definitely, if you have high blood pressure, you want to avoid medications that have decongestants in them, the Sudafeds and the phenylephrines, which are decongestants. You want to be careful of that. If you're not sure what you can take if you have high blood pressure, Coricidin is usually a safe one, or plain guaifenesin, which is like plain Robitussin that doesn't have the DM or the D or the extra strength or all of that stuff. I think that's a good thing to follow. And if you're diabetic, you want to avoid the liquid syrups that may have sugar in them. Either try tablets that don't have sugar, or try the diabetic version, because you don't want to be sick and then make your diabetes worse by taking and drinking a lot of cold medicine with sugar. But I would say take the medicine that has the least amount of things for the symptoms you're trying to treat, so that you're not taking a whole bunch of different things and you don't know what they all are.
Right. No, great advice. And, you mentioned calling your doctor. I think your pharmacist too, because you probably are going to go to a pharmacy to pick it up. If you have any doubt, like you have any underlying health conditions and you want to be 100% sure, you can just go consult with the pharmacist and they'll also let you know too.
That's
Great,
great
Karen.
advice.
I think that's helpful. I think that's really helpful. Thank you. Could we switch to prevention, please? I'm curious, what are the basic public health principles for preventing respiratory illness spread?
So respiratory illnesses spread by what we call respiratory droplets. So that means that if you are sick or around somebody who's sick and they're talking, laughing, singing, coughing, sneezing, any of those things can spread respiratory droplets. So that's how we get sick. So one of the main ways to prevent that is to cover your mouth, cough in your elbow, like we teach our children. Wash your hands constantly, because you would be surprised how many times we touch our face, or we do something, we sneeze, we wipe our nose. So just hand hygiene, whether that's washing it with soap and water or using a hand sanitizer, which is alcohol based, but that's a great prevention. And if you are able, stay home when you're sick. Stay home. You have the ability to prevent infecting a lot of people if you can stay home. I know not everybody has that option, but if you have that option, I know sometimes we want to feel, we want to push through because we don't want to let people down, but we just want to share love, like Karen said. So we don't want to share our germs. But hand hygiene, not spreading respiratory droplets, covering your mouth, wearing a mask if you know you're going to be in a close quarters with a lot of people who are going to be breathing and talking. Remember, talking helps to spread it. That's great prevention. And keeping your immune system strong so that if you do get some of those respiratory droplets from the air, your immune system is able to kind of fight it off before it takes hold and makes you sick.
Great. Thank you.
Thank you. That great rundown. And we're about to have a head of healthcare in the United States who's a vaccine denier, potentially, I should say. How should we be thinking about vaccines as a general preventive measure during this time? So, for example, people have been concerned about getting their kids vaccinated against whooping cough, or also known as pertussis. That's the P in the DTaP or DTaP vaccine, for little ones. What are the consequences of not getting vaccinated for those childhood illnesses, or potentially not getting vaccinated for COVID, the flu, or RSV if you're over 70 years old? What are the consequences?
I believe the consequences are devastating. If we just stop vaccinating our population, we'll go back to the 1800s when people were dying from illnesses that now are preventable. We have seen a lot of pertussis outbreaks because people have stopped vaccinating their children. I sometimes work in LaVale, Maryland, and there was a whole college campus that had a pertussis outbreak. We had like 20, 30 students coming in with pertussis because there was an outbreak. And as you get older, your immunity starts to wane. But when you have a population of vaccinated people and that disease is no longer present in the population, then it's okay that your immunity wanes. But when parents stop deciding to vaccinate their children and we start to reintroduce these illnesses into the population, then it can affect all of us, not just the people that those children are around, but the general population. And again, when we think about the vulnerable people in our population, the elderly, the people who have chronic illnesses, those who are immunocompromised, they will get it the worst and can die from it. So vaccines are one of the most important public health things that we have. There was a recent article that I saw today talking about the decrease of cervical cancer because of the vaccine that was developed to prevent cervical cancer, the HPV vaccine. They have worked to eliminate disease and to reduce disease. So they are our friend, and we want to continue to treat them like our friend.
Right. Kids don't get chickenpox anymore because there's a chickenpox vaccine.
How about
right?
it? How about
Yeah.
it?
Wow. No, thanks for that. Yeah.
Can I ask about nutrition, since we're talking about prevention?
Of course.
We just did a show actually a couple of weeks ago about eating over the holidays, and I'm wondering if there are certain things that we should be eating or just taking by mouth that can help with these wintertime illnesses. And ideally, none of us want to be showing up at ER or in the hospital at this time. So what can we do in terms of what we take in to help?
Yeah, prevention is always the best medicine. And nutrition is the foundation of our prevention. And so some of the things that are helpful nutrition-wise in the winter is foods that are rich in vitamin C. So you have broccoli, you have citrus fruits, you have lots of foods that are rich in vitamin C. But vitamin C, I know some people take vitamin C tablets, but if you eat foods that are rich in vitamin C, then you may not even need to take supplements. So that's a great nutrition staple to have. Also, foods that are rich in zinc. I don't know if you remember if you look at those cold E's, they mainly are full of a lot of zinc and vitamin C.
Or Zicam is all based on
Yeah.
zinc. Yeah.
So if you eat foods that are rich in vitamin C, I don't know about you, I don't like taking pills. So I would rather eat the foods that have the nutrients that I need. And then just very nutrient dense foods.
Okay.
So the green leafy vegetables, also root vegetables are great in the wintertime. They have a lot of nutrients that help your immune system stay strong so you can fight off respiratory illnesses. Soups. I know, we may think that that was something that our grandparents, did for us, but it's actually research shows that soup does help to keep us healthy because it has those root vegetables in it typically, and it has the broth. As long as you stay away from the creams and a lot of the sugars in your soups, then
Okay.
soup is a very healthy nutrition to utilize to keep your immune system healthy and to fight off illness.
I
Those
used
are
my
some of
turkey
the
bones
basic.
this year to make some broths to store. So thank you for
Oh, okay.
thank you for co-signing on that.
Broth in the freezer. I love it. Actually,
Yeah.
we're thinking, and I think that we talked about this before the show, of putting together a kind of a guide of what, reminders to put on your refrigerator and on next to your mirror and next to your bed, maybe. And I'm thinking about the types of foods that are rich in the nutrients that you were talking about, vitamin C rich foods and zinc rich foods, because to your point, you don't like taking pills. The taste of zinc is not great. So if we could put together a list, I think that would be great. You also mentioned that basically these respiratory illnesses are spread by droplets in the air. So what that's making me think of is air quality. And I wonder if you could talk with us a little bit about how important it is to focus on good indoor air quality and how we can manage that.
Mm. Absolutely. I think the wintertime, the reason a lot of us get sick and respiratory illnesses is because we're in enclosed spaces. We're indoors and we're not getting the natural ventilation that we would get in the summertime. So, indoor air quality is really important. So, making sure that your air filters and your HVAC unit are cleaned regularly. And if you live in an apartment, making sure that the apartment is doing due diligence to make sure that the filters are cleaned and changed as often as they need to be. And if you are able to invest in a HEPA filter system, like a small HEPA filter system, they worked wonders in a lot of classrooms during COVID, and they work wonders in a lot of homes. That's also helpful. You can put it in the room where you spend the most time because it's starting to purify your air. And many of us have a lot of pets, so you are building up a lot of dust and dander in the air. So that it's helpful for that too, because they have filters that work if you have pets and a lot of pet hair. But also, I know it's cold, but if you don't have any control over your indoor filtration and you can't get one of those units, ventilation is good. So either going outside or being able to kind of open the house to air at some point to get some ventilation going so that you're not breathing the same old, stale, recirculated air all the time. That's really important.
Thank you for that
Really?
wonderful descriptor. Um, and sometimes I know when I was younger, I used to get sinus infections a lot. I know for me,
Mm,
having humidifying the air in my
mm,
house helped a
yes,
lot because
yes.
that dry air dries out your normal defenses in your nose and your air passages. And so having that humidified air helps keep them, on the ball and functioning. So yeah, that's really great. In addition to the nutrition and the air, what are some other self-care tips that we can be doing to sort of keep our bodies in peak physical condition, especially during the winter?
Uh, So moving our bodies. So I like to say movement instead of exercise because when I think of exercise, I think of lifting weights or doing an hour of something, but just movement. We tend to sit a lot. Society is just set up that way that we sit a lot. So we need to move our bodies, even if it's 10 minutes of walking or, whatever it is that you can do. But movement is important. Also, sleep. Sleep is very important. You know, I had a colleague who used to suffer whenever like daylight savings happened, either way, either direction. She would suffer for like 2 months adjusting to it. And so, yeah, our sleep patterns can get thrown off by a lot of different things in the winter. It could be the time change. It could be the fact that it gets dark outside earlier. It could be the fact that we just don't have as much sunlight during the day. So making sure that you get sleep and that it's restorative sleep. So if not sleeping with the television on, even though you think that you're asleep, your brain is still processing and listening and kind of not fully rested. So, good sleep, moving your body, good nutrition, decreasing stress, making sure that
I know
you
you're
decrease your
I know
stress.
you're a life coach, so I definitely want to hear you comment on the stress and
Right.
managing the tendency to have sort of that wintertime blues. So we'd
Yeah,
love to hear from you on that.
yeah. The stress piece is a big one. For especially for everyone, but especially for women. Stress can take years off our life. It ages us. So it's not just something that we can take lightly. It affects our health. It affects our blood pressure. It affects our ability to kind of live the life that we want to live. So there are lots of different ways that we can kind of tackle stress. Um, Part of it is with our mindset. Sometimes we may not be able to change a situation, but we can change how we think about a situation, and we can change how we think about ourselves. Sometimes that inner critic stresses us out because it's telling us that we're not doing things the way we need to be doing it. And so practicing gratitude for what we have, but also gratitude for ourselves. That's one of the things that I like to do. One of the things that I'm, doing in my gratitude practice is something that I'm grateful for me. It's a way to kind of counteract that inner critic that's always telling you the things that you need to do more of. Also, with stress, the same things we talked about, moving your body helps to decrease stress. And one of the things that decreases stress the quickest and the fastest, I wonder, can you guess what can decrease stress the quickest and the kind of the most effective?
Well, for me, it's going to sleep, but I mean, it could be different things for different
That-
people.
My
That's a
guess
good
would be
one.
dance.
Okay, you're almost there. Singing.
Okay.
Well, there we
If
go.
Oh, like humming.
humming, singing,
Or
because it
singing.
raises your vibration. It's actually you
Okay.
are
Wow, I
raising
love
your
that.
vibration by singing. So you don't have to be able to hold a tune. I cannot hold a tune. But singing, humming is one of the
I love
fastest
that.
ways that you can kind of decrease stress and shift your mood. And dancing is another one also. Dance is a really effective way to combat stress. Socializing, social interaction. Sometimes in the winter, it gets cold. We don't want to go out. We don't do as many social things, but kind of finding ways to socialize. That also helps, as well as laughter. So even if
Wow.
you have to like listen to the corny jokes that your grandkids or your nephews tell, as long as it gets you laughing, it's good.
That sounds like you talk about some of your old family members, so we're not gonna say anything on that. But thank you, Dr. Brown. We really need to bring Wayne and Lila back because I know that there must be questions from the audience. And Karen's gonna put together that sort of winter wellness checklist from a lot of the things that you said. So looking forward to having Wayne and Lila come back or Wayne come back and
So
bring us the questions.
just Wayne,
Hey,
That's all right.
Wayne.
Monday is
What you do
Monday.
with Lila? Where's
Monday
Lila?
is Monday. So
And I think it was a great way to bring you back in, given that you're a musician, and we just found out that music and dance are the quickest ways to raise your vibration, or
so
singing
I
and
guess
dance.
I have to go sing tonight or play an instrument. I need to raise my vibration. Just
Right.
I think
overall, the
raise our
vibration is
vibration with
low.
that hat.
So I'm back and forth. I changed the early hat, but one of the hats I want to put on is asking questions from our viewers. And Christopher Wyckoff. See, Chris, I don't know if it's Wyckoff or Wyckoff. So next time, just, phonetically, just let us know.
Help a brother out. Help a
Help
brother out. Right.
He says, I've been popping a Zicam a day. Is that too much?
I would have to look at the package instructions. Did the package say that it's okay to take every single day? I think it might be okay, because I think it really is just zinc, and you can take a zinc supplement every day. So it really depends on what the milligrams are. So I would just check the milligrams and check the instructions, because different brands have, different amounts. And if they say it's okay for daily use, then that's great. If they say, don't use more than 2 weeks, then probably back off of the Zicam.
Okay. So we have another message from Indira Robinson. She's asked, how long should people be staying home when they have cold and flu symptoms? How long?
Good question.
Excellent question.
That's a great question. The time that you are infectious is usually the time that you don't know that you're sick. It's that incubation period that usually happens kind of 2 weeks before you even get symptoms. And then you're infectious as long as you have symptoms, right? So some of us can't stay home until our symptoms are completely gone. So I would say definitely, if you have a fever, you should stay home. That means your body is actively fighting that infection, and you need to give it the energy and the resources it needs to fight the infection. If your fever is gone and your symptoms are mild, then you could probably go back to work, but you just want to be really conscientious about performing hand hygiene and covering your mouth, and trying not to come in contact with too many other people.
And don't be shy to wear a mask when you go back to work. I'm sure.
Thank you for saying that.
That's what I was getting. Dr. Mel is really on top of it. I was going to ask, cold and flu went away when we were under mask mandates. So just mask when people were should we still be wearing them? I mean, and how much should we be wearing them, and where?
I wear a mask whenever I'm going around other people. I just do. I don't want to get sick, and so I do it to kind of protect myself. And so I would say yes. I mean, it's winter. We know people are sick. Why not wear one? It's not going to hurt you, and it might help you a lot.
Right. And also, I just want to remind people the recommendation still is for COVID specifically, after day 5 of symptoms, you can go out, but with a mask on for up until, I think, day 8 or 10, right? So if you have COVID and you're recovering from COVID and you still have symptoms, you should be, from day 5 to day 10, be wearing a mask out in public, and from day 0 to day 5, be home.
Okay. So you heard Dr. Mel with the mask mandate updates. Anyway, Chris also asked, what are some of the immune system maintenance care foods and supplements aside from the usual, like vitamin C?
Okay. You said maintenance care foods?
Yeah, like foods that we can, besides the general vitamin C, everybody take your vitamin C. What are the, the maintenance care foods?
So I would definitely say your vegetables, nutrient dense foods. So your vegetables, other foods that have a lot of nutrients in them. So if that's your fruits, your protein, your whole grains that you're going to be eating, legumes, those things that are nutrient dense, not the fast foods and the sugary snacks and those types of things. They're not going to really help your immune system. But foods that are going to give your body nutrition and fuel that it needs to function, and the fuel that it needs to boost your immune system and keep you safe. Vitamin D rich foods we talked about before, so things that have a lot of vitamin D in them. And as well as you already mentioned vitamin C and you mentioned zinc. Magnesium's also good. Magnesium rich foods are going to help keep your immune system and your body functioning well also. And we'll include that on the sheet, right?
Right.
Yes.
Yeah.
Nuts are a
gonna
great
say.
nuts are a great source of magnesium. Fatty fish are a great source of vitamin D. And I didn't make this connection until recently, but when we talk about vitamin C, isn't it wonderful that citrus fruits come into, are most available in the wintertime? That's their
Right.
season is
Mhm.
winter.
Right.
So it's like,
Yep.
we've been given this gift of
Mhm.
grapefruit, oranges, etc., right when we need them the most to boost our vitamin C in the wintertime.
Yeah, that's incredible. So we have a question. Let me go to it. That. What self-care tips do you have when your immune system is functioning at its highest? Like, so everything is healthy. What would be your best self-care tips for that?
Mm. So that's self-care for maintenance, right? Because your immune
Mhm.
system is functioning at its highest. So you're probably doing a lot of the right things.
Mhm.
So keep taking care, keep taking care of yourself. So the sleep is still important. The mental, I look at it sort of like in all of the aspects, right? So
Mhm.
mental, feed your mind. Sometimes we have, if we're working in a career for a while, we're not learning new things. We want to continue to learn new things so that our mind could continue to be fed. Emotionally, making sure that this is one that may be a little bit new, but there are things that make us angry. And sometimes we suppress that anger. Don't suppress your anger. Find safe ways to express your anger. They have these places you can go and break things if that's your jam.
Where is that?
Do my son went there for his 18th birthday party. So I think they have them all over. Or if it's just talking to somebody that you trust and just get it out. Because when we suppress our anger, it may not show up now, but it'll come back to bite us and it can affect our immune system. It can affect other parts of our health. Spiritually, you don't have to be religious, but if you have a spiritual practice, it's been shown that whether that's prayer or meditation or affirmations or just believing that there's a power higher than you,
Mhm.
it's been shown that that leads to higher levels of well-being, higher levels of happiness, higher levels of health. And we talked about socially, making sure that you are keeping your social, the things that you need to do socially charged. A lot of people got really depressed during COVID because they couldn't socialize with other people. We need that human connection as well. So if you're already functioning at your best, then I would say think about it from social, emotional, mental, spiritual, because you've got the physical down.
Okay. Got
Love
two.
that.
We have
Thank
two
you.
final questions, and we're gonna give them about 2 minutes apiece. One, is there a treatment for RSV or the flu? Is there a treatment for that?
That's a great question. So there is no treatment for RSV. RSV is a virus that does not have a treatment. But if you get really sick with RSV, you may need to be hospitalized to get supplemental oxygen for your breathing because it affects your respiratory system. And some people get really sick that their oxygen level gets low and they're not getting enough air in and they might need supplemental oxygen. So hospitalization can be a treatment. Um, Humidifiers can be a treatment if you have mild symptoms. Um, but there's no medication treatment. For the flu, there is a medication treatment. It's Tamiflu.
Okay.
And if you get the flu and you are seen by your doctor within like the first 48, sometimes 72 hours, then you're eligible to be treated with Tamiflu. And especially with kids, we want to get them treated, and pregnant women, we want to make sure they get treated as well.
Fantastic. We have one last question coming up from Lynn Hickson Tenney. Is Alzheimer's the new diabetes 3? And how to guard against dementia? Good luck.
That's a good question. Alzheimer's is a vascular disease. Okay, so it affects the vessels in the brain, and diabetes is a vascular disease also. It affects the vessels in lots of different parts of our body. So there are some similarities between Alzheimer's and diabetes. I'm not sure we've classified it as diabetes 3, but there are some similarities there. So we know that what we eat affects our bodies and affects our brains. We know that when we have foods that are rich in omega-3 fatty acids, that's good for our brains. When we have, vitamin E, that's good for our brains. When we keep our brains active, when we're constantly kind of challenging our brains to learn new things, that's also good for our brains. And then there's some things that we know that are not as good. We also know it can be hereditary. So sometimes, it runs in the family. So if that's something that you're concerned about, I would definitely suggest talking to your doctor about it and doing your own research and seeing what are the preventive things that you can do now to give yourself the best chances of avoiding Alzheimer's. Now, I'm going to crowdsource this answer. Do either of you have anything else to add on this one?
The only thing I would say is, we really don't know what causes Alzheimer's yet. There's no smoking gun. But a lot of things that Dr. Brown ran down in general in terms of life choices, diet choices that you make for overall wellness are things that have been shown to be protective against Alzheimer's. So take notes on everything she said and put it into your practices, into your daily practices, because those are some of the most potent things that we know that decrease the risk of Alzheimer's disease. Even if you do have a genetic predisposition, we covered a show on our item on our weekly recap a couple of weeks ago where we talked about the role of exercise in prevention of Alzheimer's and how that lowered risk even in people with genetic predisposition. So take all copious notes from what she said, because I think that will hit two items at the same time. I don't like to say kill two birds at one stone. It's too violent. It's violent. So
save the birds.
Dr.
Save
Brown.
the birds.
Yeah, right. Save the birds. Dr. Brown, thank you so much. You were such a wealth of knowledge in terms of explaining things. Absolutely. Thank you, Karen, as always, for being here with us. Lila, we love you wherever you are. And Wayne, thank you so much, my producer. And of course, to the Be Health Empowered family for the wonderful questions and for tuning in. Thank you so much. We will be back here next week, so stay tuned. And until I see you, be wise, be well, and be health empowered. Thanks for tuning in.